Hello and welcome back, Radiography Champs. If you're part of this growing community of future experts and you're seeking to understand your exposure techniques, you are in the right place. As today, we'll be addressing a student's concern from the survey conducted on one of the most fundamental yet often misunderstood fundamental concepts of radiography: the control panel decisions that make or break your exposure, the kilovoltage and milliampere second, otherwise called kV and mAs. Let me take you into a quick story on the radiographer's dilemma. Picture a new radiographer, whom we'll call Fatih, and on her first solo call duty, a patient rolls in with a request for a chest x-ray. Fatih pauses at the control console. Should she increase the kV to ensure enough penetration or boost the mAs to avoid a noisy, underexposed image? Fatih takes a deep breath, assesses the patient, and adjusts both, not just randomly, but strategically. The image is diagnostic and optimized, no repeats, no overexposure. This narrative captures the essence of the real-life complexities radiographers face daily, where every patient brings a new puzzle to be solved at the control console. The radiographer constantly navigates between physics, anatomy, and safety for every patient. So what do KV and MAs actually control? How do they affect image quality and patient dose? And how do we make smart, safe exposure decisions, even under pressure? Let's break it down. The kilovoltage or kV, preferably called kilovoltage peak or kVp in X-ray production, refers to the peak electrical potential difference applied across the tube. Electrical potential difference, in simple terms, refers to the push that makes electric charges move in a circuit. Imagine a water tank connected to a hose or what we call a pipe. The higher the water level in the tank, the higher the pressure that pushes the water out of the tank into the hose. That height difference is just like the electrical potential difference. It gives the water, or in this instance, the electrical charge, the energy to move. The greater the height difference, the faster the water moves. Just like a higher potential difference will cause electrons to move faster in a circuit. Now in an X-ray tube, the potential difference, also called the voltage, or in this instance the kVp, between the cathode and the anode is what accelerates the electrons across the tube. And the higher the voltage, the more energy those electrons gain, which leads to higher energy, more penetrating X-ray photons. The mAs, on the other hand, or milliampere second, is simply the total number of electrons, hence the photons, that flows in the circuit during an exposure. A higher mAs means more X-rays, that is an increase in the beam's quantity. And on the other hand, a lower mAs also translates to lower X-rays, or a lower quantity of X radiation. Thus, the mAs controls the quantity of radiation that will be produced, hence the quantity of radiation also that will go through the patient. Let's now talk about how they affect image quality and radiation dose. Here's the golden rule. A higher kV equals more penetration. However, with less contrast due to scatter radiation as a result of the Compton effect that predominates at higher energy levels. While more mAs equals more density, more detail, but at a cost. The cost will be an increase in the dose. Here's how it plays out. A higher kV gives you better penetration, especially for thicker body parts, but it reduces the contrast by making almost everything appear green, while a higher mAs makes an image less noisy, less grainy, but it's also where most of the radiation dose comes from. Think of kV as rainfall, with low rainfall, which in this case will translate to a low kV. The rain barely gets past the surface of the roof and then it runs off quickly. With heavy rain, however, which would symbolize a higher kV, it can seep into cracks and soak the wall underneath. That is deeper penetration. But if the rain is too intense, it floods everything and washes away contrast. On the other hand, mAs is like the amount of paint you require to paint a wall. Too little paint, which in this instance would symbolize low mAs, would leave patches on the wall, which translates to the image looking grainy or noisy. An increase in paint, meaning a higher mAs, gives an even coverage and smooth finish. That is a clear image. But if you use too much paint, it becomes wasteful and messy, just like excess dose without added diagnostic value. Therefore, achieving a balance between the two is essential. Not too much, not too little. There's a saying that in radiography, just as in life, image clarity comes not from more, but from just enough. So, how do you make smart and safe exposure decisions? This is where theory meets practice. Ask yourself, what am I imaging? What is the patient size? Do I need contrast or just penetration? Refer to an exposure chart. Some departments have that and is meant to be a guide for exposure factors for average size patients. Also, you can check the control console. Modern X-ray machines come with preset exposure factors for specific patient habitus and examinations that you can use to guide you on your selection of exposure factors. You can also consult your texts and your lecture materials, or you can try to remember what factors you used for a similar examination in the past. Then follow the decision tree. What is the size of the patient? A big patient, you can increase the KVP to allow for better penetration, then adjust the mAs as required. Or is the patient too slim, slimmer than an average patient? You can modify your exposure factors by reducing your penetration as well as the mAs to achieve the required density. Do you need more tissue contrast? Especially in examining areas that have similar tissue densities. For example, carrying out soft tissue neck X-ray as against a cervical spine X-ray. Keep the KV lower and increase the mAs but within the safe limit. Are you handling a pediatric case? Lower both exposure factors. Prioritize dose reduction above all. As a rule of thumb, if you increase the KV by 15%, you can have the mAs and achieve the same image quality, especially in analog film screen systems. This will help you maintain exposure while lowering the dose, what is known as the 15% KVP rule. More on this on another video. Using these steps, you can make your exposure and get a clear image on the first attempt. No guesswork, no repeats, just applied knowledge. So next time you stand in front of the control panel, channel your inner Fati. Ask yourself, am I adjusting for power, quantity, or both? What does the patient really need? How do I balance image quality and safety? Remember, you're not just pushing buttons. You're making decisions that will affect diagnosis and dose. So own that responsibility. If this helped make KV and mAs finally click, please give the video a thumbs up. And don't forget to subscribe for more on understanding radiography. Got any questions or confusing cases? Kindly drop them in the comment section and let's break them down together. It's bye for now.